And it's been 5 weeks of OMG, WTF, all kinds of stuff looking at these numbers. Last night's numbers reported out of the Joint Information Center. And you know what I mean, right, guys? You wait for these JIC releases to come out, and you just, like, pray to God that it's going to be, at this point, I'll take 50 cases. 75 might even be, like, a little bit of, like, ooh, okay.
Yeah.
But no, that's not.
It's 160 some, right?
169 reported last night, Lillian, and the hospitalizations jumping quite a bit to 55 hospitalized. And this is between GMH and GRMC, 9 in the ICU. Lillian, can we just go over what's going on at the Guam Memorial Hospital? Good morning. Thank you for joining us.
Good morning. Good morning, Guam. Right now, this morning, we have 26 in the house. Yesterday, we had 25, but we also had like about up to as high as, I think, 15 new cases in the emergency room, waiting and being seen and being treated. 7 of them were in the Blue Met tent. So it was really a good thing that we have that Blue Met tent set up right outside of ER, because we used it yesterday for the overflow of COVID patients. And so in the house yesterday, as of 6 p.m., a total of, like, I think 37 or 38 COVID patients or individuals in the hospital, although 25 were already admitted to the inpatient units, and then the others were in the ER and Blue Met waiting for, a decision whether or not they're going to be admitted or discharged home to home isolation. But, the numbers are high. And so really, again, we plead with the community to continue, the precautions of face mask, hand washing, and social distancing as much as possible, and get vaccinated if they can.
All right, so 26 right now at least, right?
Yeah.
Correct.
Do you have a break?
One is in the ICU level of care, receiving supplemental oxygen. 15 of those 26 are in the telemetry unit, needing constant cardiac monitoring. And then 8 of them are pretty stable, and so they are now in the medical surgical unit. Hopefully that they can then be released home. And then 2 of them are in the pediatrics unit, one under 1 year of age, and the other is under 12 years of age.
So we have a couple pediatric COVID admissions?
We do. And yesterday there was also another child who was under 1 year, 1 year old, in the emergency room. Fortunately, the child, the symptoms, fever and oxygenation level, though, was still pretty good, and so did not need supplemental oxygen. So because of that and the condition of the child was fairly stable, the doctors released the child to home isolation with the family.
Lillian, are these children who are presenting up at the hospital, are their parents coming in positive for the virus?
The one child was under 1 year of age in the house. Both parents are, yes, they have the COVID infection, and they are both unvaccinated.
What are the parents feeling, Lillian, when you guys talk to them? Because I can't even imagine.
I haven't had the chance to have an interaction with the parents, and I haven't had a chance to talk to the nurses, Yeah, I mean, I wonder too. I mean, they must feel, I'm sure they're feeling bad that their child, has the COVID, but I haven't had that interaction at all or any feedback from the nurses.
Are you still
the pediatric nurses?
Are you still seeing a stream of kids coming through the ER with symptoms, but being released to like home care?
Yeah, we in the last couple of days we have seen even as young as, I think, 2 months, 11 months, and definitely under 10 years. We have seen some in the last several days. Yesterday, in my memory and the report I read, One of them came in, was under 1 years old, and was seen in ER, stable, and released home. But that's the concern is, again, the children coming in infected with COVID.
Lillian, we were. What have you heard from GRMC? Right, because they have a PIO, but I think she's on leave, so it's been very hard for us to get information out of GRMC. But I'm pretty sure that you guys have discussions, because if you just kind of half the rest of the numbers between GRMC and then we know what's going on at Naval Hospital, it kind of looks like just based on the math that GRMC has a significant amount of COVID patients, even in the ICU.
My last conversation with the nursing director a couple of days ago, they also had like 20, if not 20, then 22 individuals with COVID. We didn't go into details as far as what their conditions were, but their numbers are also in the 20s.
Yeah, as of last night, there were 27 at GRMC.
Oh, wow. See, we're basically trailing the same numbers.
I mean,
here and GRMC.
I got to say, I mean, knock on wood, I mean, I can't imagine, because during the first surge, GMH was designated as the COVID hospital. So if GRMC wasn't like kind of halving this load with you guys, I mean, the numbers would just be really, really, really alarming at Guam Memorial Hospital, right?
Yes, it is for the island of Guam. It's alarming.
Is GMH, are you guys going to need another tent?
Right now, I don't think so. Yesterday, we had 7 in the Blue Med tent. This morning, it's kind of cleared out, the Blue Med tent. So, on a daily basis, we do monitor it, maybe even 4 times a day. We keep track what's going on. And if we do need, then we will submit a request, a DLAN ticket. But, to find a place for it, we're going to need to really strategize it, where we will put the second tent if we need it. Last year, we talked about putting it right outside of the where the doctor's parking lot is. And so that may be the option that we will go to if we need to put up a second tent. We're hoping that we don't have to, but if we do need to, then that's where we will put it. We have to we will maximize though what we have already established, like the COVID care 2 unit, which is right outside, right in between ER and ICU. That was the special services clinic that we converted that to a COVID care 2 unit, which is an ICU, an additional ICU, 4-bed ICU unit. And then we also have on the 4th floor, we call it the Care 3. So we want to make sure we maximize all the rooms that we've got, all the beds that we've got in the physical structure before we pull the trigger to say, okay, we need that second Blue Med tent.
So the patients that are in the Blue Med tent, Lillian, I don't know if you asked already, what's the capacity? And then so the patients that are in there, they're not admitted, right? But they are being monitored?
Right. They're being monitored. It's an overflow. It's an extension of ER. So any overflows of COVID patients, we place them in that Blue Med tent because it's got negative air pressure. It's air conditioned. And so it basically has all the infrastructure, and it can accommodate 10 fast beds.
Have there been any deaths, Lillian?
Not recently, in the last 24 hours. I believe the last one was the gentleman that was in his 80s or 70s. I can't even remember. But I think it was the last 2 days that we've had. In the last 24 hours, we haven't had a death. At least I haven't received a report.
Right. It's really scary that we had Dr. Ho on, I want to say 3 weeks ago. And he talked about one of the triggers when you really start looking at implementing restrictions and protocols to mitigate the spread of the virus. One of the triggers, he said, was 10 hospitalizations. And now it's just, I think people are freaking that we're at this point now where not only do we have 55 divided between the hospitals, but we've got the blue med tent up, right? And so people see that when they pull up, and I know your staff saw it being put together. What does that kind of do for just the mindset and the morale of the staff when you do that? Because that's like a real sign that, I mean, I know they know it's already serious, but when you get that blue med tent up, it's, whew.
Well, it shows that, the numbers are rising and the numbers of people needing hospitalization or emergency room examination and treatment. And so, on our part, we just need to make sure that we have the capacity and to make sure that we treat these individuals when they come in and that they have a bed space to occupy, while they're getting examined and waiting for the results or waiting to then be stabilized so that they can go home in the comfort of their home, but continue the isolation, or that they go to the Bayview if they're not able to go home for whatever reason, that their home is not yet set up to adequately isolate themselves in one room. And so the Bayview is there. But, again, the assurance is what we want to give the community that they will be taken care of when they come into GMH or even to GRMC, that we have the capacity, we have the resources. We're stretched, we're limited, but, we've always done this. We do what we need to do, given what we've got. So, and everybody's pulling they're towing they're pulling they're putting themselves to come in and work and do their part. So everybody's working together to get through this.
We had Chima on yesterday, and he told us about the medical staffing request made to FEMA, and he said that they're bringing in several individuals. I think it was up to 40, right?
Staff,
right, up to
medical resources,
right, and they're going to be, I guess, deploying some to GMH to help with the administration, I believe, of Regeneron. Can you tell us about how this is going to work for GMH? How many people you guys are anticipating to go over there to stand up this this site?
Well, we already have 4 medics from the gang assigned here to GMH, and so they're helping us out in the ER. They're augmenting our staff in the emergency room. And yes, we've had a couple of meetings with Public Health, GRMC, Governor's Office, and I forgot who else, the gang, the TAG General herself, discussing the options to have additional sites to administer this Regeneron. And it really can be done on an outpatient basis. We started giving it here in the emergency room, when the doctors determined that, certain individuals with COVID meet the qualification, meet the criteria to receive the Regeneron infusion. But we cannot be the only site to administer it. So the governor, in her direction, was to have for the healthcare system to work together and identify alternate sites, additional sites. And GRMC has offered that they also are willing to do the Regeneron infusion at their facility. I understand that they're setting up another site near GPO for that Regeneron infusion. But yeah, if we could get additional resources, additional manpower, that can certainly help with the treatment part of this COVID, so that we can prevent or minimize individuals coming into the hospital.
What about the SNF? Is it full?
Right now we are at 24. The census is at 24. And so the doctors continue to identify patients here in the acute care facility who no longer need to be in an acute care facility, and then can, be transferred over to the SNF. And these are all, again, non-COVID adult individuals. and because we cannot mix the COVID and non-COVID over at the SIF, given the ventilation, we haven't been able to get that ventilation issue resolved and separated between the three wings. So we're keeping it as non-COVID unit or facility.
Lillian, I was looking at the surveillance summary from Public Health for last night, and it says 62 are in the isolation facility. Do you guys see any patients who are in the ISOFAC migrate over to the Guam Memorial Hospital, or what's your involvement with the isolation facility, if any?
If patients are discharged from here with COVID and their home is inadequate to keep them isolated, we refer them over to the Bayview ISOFAC. Not a whole lot, but at least we have that option for these individuals, that if they can't go home to continue the isolation process, then we refer them over to the Bayview ISOFAC.
I mean, not a whole
That's our
lot.
relationship
That's
with them.
62 people, right? That kind of seems like that's a pretty big number. So some of them discharged from GMH, inadequate home setting for isolation. They go over to the ISOFAC. Is that all 62 or?
No, the ISOFAC, I believe also from public health themselves,
Right.
when they identify individuals who are positive and they contact the individuals and the individuals say, well, I really can't continue. I can't isolate myself here in my home. So then public health gets them over to the Bayview ISOFAC. So it's not just us referring people to the ISOFAC. Many different sources, refer those individuals
Right.
to, or they self-refer themselves.
I mean, that's interesting
Or
because
from the private clinics.
there was conversation a couple months back, Bree, where they wanted to combine the facilities, but now it's kind of looking like maybe a good call that they didn't. I mean, I don't know what's going on with the quarantine.
They still need to keep the QFAC for those individuals, passengers who are arriving and are positive for some reason. They get tested, then they are quarantined there in the QFAC. They're not, wait, hang on, let me rephrase that. The QFAC are for those individuals who are exposed. That's what the quarantine is for. The isolation FAC are for those who are positive. So I guess in their contact tracing and people are exposed and they don't have a place to quarantine, then they go into the QFAC. Or those travelers who are arriving, they get placed in the QFAC, is my understanding.
Thank you for that clarification. Looks like we got to ask about the QFAC now, the census there.
Right.
Yeah.
And I'm not the expert of that.
I know,
I don't oversee that.
I know.
So, yeah. I'll let our answer that, or
Right.
Chima.
Right. The 26 that are in at GMH, what's the breakdown in terms of vaccinated and unvaccinated?
Believe 18 are unvaccinated is what I had communicated to Crystal
Okay.
last night.
The one person
Is it
that's
17 or 18? Go ahead.
The one person that is in ICU currently, is that person vaccinated or unvaccinated?
You know what? I need to look back at the report, and I'm using my phone, so
Okay.
let me see if I have it on my report. If I lose you, hopefully I don't lose
It's
you.
okay.
Give me a
It's okay.
second, okay?
Mhm.
Let me just take a look.
We're on with Lillian Posadas, the hospital administrator. And she's painting a very grim picture of the goings-on at the Guam Memorial Hospital as they're at capacity, and they had to set up the Blue Med tent, which is handling spillover patients, and they're seeing a lot of sick kids with COVID cycling through the emergency room. They do have several pediatric admissions, guys, so pretty serious. Again, stay home. Remember, a lot of our children are unvaccinated, and if you're unvaccinated, you get the COVID, there's a higher chance that you could experience severe symptoms or even hospitalization. So really important to just protect the kids, guys. Limit your movement. I mean, I would say everybody just kind of limit your movement. I know it's a 3-day weekend. There are those gathering limits in place as per the governor's executive order.
10 vaccinated indoors and 25 vaccinated outdoors.
Right. but just because that's kind of like the bar, I feel like it's a little high, honestly. Doesn't mean you have to go and gather, 10 and 25. And I know it's tempting with a 3-day weekend, but remember last year during the surge, they would always say whenever there was a holiday that they kind of watch and look at the case count because people tend to gather, right? So that's why I'm saying don't, please, guys.
Yeah. Just hold off on the celebration till next year, or till we really get out of this. But yeah, I mean, we're human beings, and we're social human beings. We like to gather, and we like to get together. But in the meantime, we just have to kind of sacrifice that gathering until later on when things kind of hopefully calm down. But the two individuals who are in the ICU, one of them is still in the ICU level of care. The other one has been, I guess, now telemetry level, but physically still in the ICU. They will move that individual out of the ICU to a telemetry bed. Both of them are not vaccinated.
Lillian, we had a comment here, and also I want to ask because I know a lot of people who had COVID and have caught it again, right? So are you seeing people getting reinfected with the virus at the hospital level?
We have seen some who, upon discharge, they are COVID free. Their symptoms and plus their test results come back negative. They go back home, or however they get exposed and they get reinfected. Yes, we see some of that.
Right, because
is it a big number of people?
Not a huge number, but again, it is happening, the reinfection.
Wow. Well,
I wanted to ask about the children. Do you guys have to make like special spaces for the kids so where they're not like they're separated from the adults, or you just kind of put everyone together? I just wasn't
they're
sure.
Separated from the adults. They are put in the pediatrics unit.
Okay.
That's hard. Yeah. And so I mean, last year we were struggling because again it was all new to us. We didn't have much of any information. So yes, we did whatever pediatric cases that we had them with the adults. But of course, the parent is with that stays with his or her child. But now that we have more empirical experience and scientific information, we have more PPEs, our staff are trained, and they feel more comfortable and more knowledgeable. So all pediatric cases with COVID get put into the pediatrics floor.
And because you're seeing an increase in children getting sick, do you guys have like the space in case we start to see more children getting hospitalized? Beds?
The pediatrics, we do have it's an 11 bed, and we haven't really been struggling with getting more pediatric patients in that unit. Fortunately, the ones that come in through the emergency room are fairly stable. Their oxygenation level is pretty good, and so they get to be released home. So we haven't had the need for more pediatric beds. And so, but the trigger point is if we start filling up to 10 pediatric patients with COVID in the 4th floor, then definitely we're going to need to find options to place these patients, pediatric patients.
Lillian, what's the policy for pediatric admissions relative to parents or legal guardians being able to accompany?
To stay with their child?
Yeah, if it's COVID.
One parent is allowed.
One parent is allowed.
What was the question? I'm sorry, I didn't hear.
So if the kids are COVID positive and they're admitted, one parent gets to accompany the child?
With or without COVID, we still allow a parent to be with the child. Yes.
That's great.
Well, thanks, Lillian.
Yeah, you got any good news in there?
Yeah.
Okay. Tell us a joke or something.
I know, right? Well, we have to have humor. We got to have humor in the midst of all this because that's how we can cope with it. That's how we can get through this and have hope.
Amen.
There is hope.
Knock, knock.
Yes. Take care.
Right on.
All right. Thank you.
Thank
Thanks for
you.
the
All
time.
right.
Oh, man. Back to square one. I don't know. I feel like it's almost, other than the deaths. Remember last year in the surge, we were just seeing the deaths